Good afternoon. My name is Celeste Apo, course leader for Nursing 119. Today, we're going to do a demonstration of proper medication administration, and it really focuses on the role of the proctor. Thank you. Good afternoon, Amanda. How are you?
I'm good, Mrs. Apo. How are you?
Very good. Are you ready to start your practicum?
I think so.
Okay. First of all, do you have your skills verification sheet?
Yes, I do.
Okay. Let me check it. Okay. Each student must have this sheet to show that they practice medications in the lab and give it right back to them. Okay. Do you have your homework? Okay.
Yes.
Okay. Okay. Each student should have their homework completed from the study guidebook, and when it's finished, give it right back to them after you check it. Okay. Very good. Okay, and I'm going to give this back to you. All right. Do you have your medication worksheets?
I do.
Okay. All right. So let me just check them to see if they're filled out. Okay. And look like you have them all filled out. Okay. All right. Very good. So the next thing we're going to do is we're just going to discuss a little bit about the medications.
Okay.
All right. Okay. So let's see. What do you have? All right, let's start with low pressure.
Okay.
That's a common classification. What is the trade name for low pressure?
The trade name would be low pressure.
Very good. Can you tell me what is the generic name for low pressure?
Metoprolol.
Very good. Okay. What is the therapeutic classification?
The therapeutic classification would be an antihypertensive.
Okay, and what would be the pharmacological classification?
That would be a beta blocker.
Okay, very good. So actually, what do beta blockers do in your own words?
So they help with people who have hypertension. They help to lower the blood pressure and the heart rate.
Very good. All right. Tell me 2 common nursing assessments you would make prior to administering low pressure.
You would definitely want to take their blood pressure and their heart rate, especially the apical.
Very good. All right. So how do you know metoprolol, which is low pressure, has been effective?
By a decrease in their blood pressure and heart rate.
Okay, very good. All right, very good. Seems like you did very well with that one.
Thank you.
Let's see if there's another medication we can go over. And your sheets look very well. Okay. Let's talk about slow K or micro K. It has a lot of different terms.
Okay.
So what exactly is slow K or micro K?
That's a potassium supplement.
Okay, very good. Why would people need a potassium supplement?
If they had low levels of potassium and you wanted them to be in a certain range.
Okay, very good, very good. So potassium has a lot of side effects. Tell me something you can do as a nurse to decrease some of the side effects they may have.
You can give the potassium with food to reduce the GI disturbances.
Okay, very good. Also, potassium is a very large pill. What might help the patient to swallow it? Okay.
Sometimes you can help to cut it if it's able to be cut.
Okay.
You can even put it in applesauce or a food like that to help them swallow it.
Very good, very good. All right. So let's see here. What else do we have? All right, the next and probably final medication we're going to talk about is Lasix.
Okay.
All right. What is the generic name for Lasix?
Furosemide.
Very good. All right. There are a lot of reasons, but tell me a few reasons why someone would take furosemide.
Mainly it has to do with if they have a lot of fluid retention and sodium retention, like CHF and pulmonary edema, to help get rid of that fluid.
Very good, very good. So let's see. After you administer furosemide, what type of response or what would you expect to see from the patient?
You would hope and look for a decrease in blood pressure and an increase in their output, that they would be urinating a lot.
Okay, very good, very good. All right. So again, tell me why a lot of people would take then Lasix and potassium together. Okay.
Because when you are on Lasix, you get rid of a lot of the sodium and potassium and water.
Okay.
So you want to make sure their potassium levels are good.
Very good. You've done very well. All right. So this is the end of this portion. And next, then we're going to move over to the medication cart.
Okay. So at the medication cart, I'm going to get my patient's drawer. and I'm going to compare it to the information on the MAR. So I have Michelle Branch with Dr. Robert Sloan, medical record number 368214, and the date of birth matches. So I'll be bringing this back to the table. I also do my hand hygiene. And I get my Tylenol as my PRN, medication cups, one for a parameter, one for everything else, and something to pour the Tylenol in. This has been my first check at the med cart. And now I'm going to take my medication from the drawer. So first I have my Lasix, and I compare it to my MAR. I have 20 milligrams. I see I need 40 milligrams. So I need to get 2 of them. And I put them in my cup. I then need potassium. And I see I have 20 milliequivalents, and my MAR says I need 20 milliequivalents. I also check the expiration date on my medications and put it in the cup. Lastly, I have my low pressor. I see that I need 50 milligrams, and I have 50 milligrams. I check the expiration date, and I put it in a separate cup because of its parameters. I can then take all of my cups in my drawer back to the table where I can pour my Tylenol with my MAR.
All right. Are you ready for me to check your medications?
Yes, I am.
Okay. Okay. Low pressure. So your low pressure is correct. Okay, your potassium is correct. Furosemide is 40 milligrams. It is correct. Okay. Assume your patient has a headache and they would like something for their headache.
Okay. So I see that they have Tylenol 650 milligrams ordered, and I see that it was last given at 7 a.m., so it's been adequate time and I can give it again.
Okay.
So I brought my Tylenol with me, and I see that this is 325 milligrams per 5 ml. And I know I need 650 milligrams, so I need 10 ml.
Okay.
And I also see that my expiration date is good. So now I'm going to pour my medication, and I have to get eye level. And because it's an elixir, I have to mix it up and open it. And I need to put my palm to the label, find my 10 milliliters, and pour at eye level. Making sure the bottom of the meniscus is level, and I have my paper towel to wipe the top, and I can recap my Tylenol. Would you like to check my Tylenol?
Yes. Very good. You have 10 mLs. Very good. Now we're ready to go to the bedside. You can take all your meds to administer. Okay?
Good morning. I'm Amanda, a student nurse with RCBC, and I'm here to give you your medication today. I'm going to come over by you with the table. I'm also going to close this curtain to provide privacy. First, I'm going to verify the patient's name, date of birth, and medical record number. So I'm going to look at the armband and compare it to my MAR. I'm also going to ask the patient, can you state your name and date of birth for me?
Michelle Branch, 12/8/65.
Thank you. And now that I see everything matches, I'm going to check the allergies. I see that you have an allergy to peanuts and aspirin.
That's correct.
Okay. Are there any other allergies?
None that I know of.
Wonderful. So now we're ready to give you your medicine. First, I'm going to sit you up. into a semi-Fowler's position. So that's easier for you to take your medicine. So what I have for you today, I'll give you in just a moment. I'm going to do my third check now. So now I'm going to take my cups and compare them to my MAR. I'm going to verify my low pressor, or metoprolol, and I have that. My two other medications are going to be my potassium, okay, and my 2 Lasix, or furosemide. Okay, so now that my third check is complete, we're ready to give you your medicine. Do you still have a headache, Mrs. Branch?
Yes, I think it's about a 4 on a scale of 10.
Okay, perfect. I have some Tylenol here for you to give you as well for your headache. The other medications that I have for you are your metoprolol, or low pressor. This helps with your hypertension to lower your heart rate and blood pressure. I also have your diuretic, which is your Lasix. You may call it your water pill. This helps you to get rid of all that extra fluid, and it also helps to lower your hypertension. So you may be going to the bathroom a lot with this medicine. I also have potassium, because you may be getting rid of some with the Lasix or diuretic. So we want to make sure you have very good levels. And then lastly, I have that Tylenol for you. How would you like to take your medicine? Would you like to take it one at a time? All at once? You tell me.
All at once with a little bit of water.
Okay, so I have my pitcher here, and I can pour some water for you. And now I'll be giving you your medicine. I'll check first that the blood pressure was taken just before this and indicates that I can give you your low pressor and Lasix. I also want to check the heart rate to make sure that that's within the parameters for the low pressor. So I would give the medication, and I would make sure that they swallowed the medication themselves after taking it out of the package to make sure that they weren't cheeking anything. I could then give the Tylenol and make sure that they swallowed that as well, and that they had plenty of water afterwards. Mrs. Branch, how are you feeling after that?
Right now, I'm okay, thank you.
Okay. I'll come back in half an hour approximately to check on your headache and the rest of your medicines. Do you need anything else before I go?
No, thank you, I'm okay.
Wonderful. I'll just lower you down to the lowest position so that you stay safe. I'll leave you sitting upright a little bit if that's all right with you. All right. You ring me if you need anything. Here's your call bell, nicely by your hand. Thank you, Mrs. Branch. Now I'm going to document that I gave my medication. So I'm just going to put my initials, A-T, for low pressor. I'll then move down to potassium and write my initials again. I'll then go down to furosemide or Lasix and write my initials again.
Demonstrate how you refuse. Just pick anything.
And if, for example, my patient refused the aspirin, I would have to put my initials and circle it and put an R next to it for refusal. I also gave Tylenol, so I have to go to the back to the PRNs, and I would have to write that I gave it at 14:10, which is the current time, and my initials. I would move down to the bottom of my sheet, and I would write the current time, again, is 14:10, which is when I gave the medication. And I'll put my time here of 14:10. And to complete my documentation, I have to put my initials, A-T, and my name for the next shift to verify who I am and who gave the medication. Amanda Tyrone, SN, RCBC. I'm now ready to present my documentation to my instructor.